Greetings from Amrita. Amrita is a decision support that we provide to the village health workers. It is available in low-cost J2ME enabled mobile phones as well as in low-cost handhelds. It is available in English as well as in vernacular languages. Tamil has already been worked out. The software is separately customized for a village health worker's encounter with the patient, which could either occur at a PHC, for which we have a PHC module, or it could also be at the doorstep, for which we have a home module. Now let us consider a case of Rama, who is a 4-year-old girl child in the village. She has loose motion for past 10 days. Her mother has been unable to take her to the hospital over the last week. Now that it's 10 days already and there is no improvement, her mother panics. Let's see how Amrita helps the village health worker to take the decision. Since malnutrition is highly prevalent in our part of the world, it becomes customary to screen every child for malnutrition. There are indicators like mid-upper arm circumference that is often used to make this clinical diagnosis. The one we use here is the child's weight. The village health worker is expected at present to plot the child's weight against the age and find whether it is appropriate, low or very low compared to the expected weight. The WHO has designed similar charts saying weight for age chart, which the village health worker uses at present. This cumbersome process can be bypassed in a decision support that we provide. The device gives a decision like this. The next thing that the device does is it screens the child systematically for the presence of any of the alarming signs. Say if the child is unconscious, if the child has an inability to drink or a possible positive history of convulsions. Say in this case there is none. Now through the standard protocols that we use, we assess the child for the 4 ailments which account for a high of 78% of the under 5 mortality, namely acute respiratory infections, diarrheal disease, febrile illness and malnutrition. Let us assume a case if the child had a cough or difficulty in breathing. The whole set of questions regarding the assessment of respiratory infections come up. However, since in our case the child does not have a respiratory infection, we will go back and say no cough or difficulty in breathing. To save the village health worker's valuable time, the software directs her straight into the next set of questions pertaining to the assessment of diarrhea. If you remember, Rama has been having diarrhea for the past 10 days. On being asked whether she had passed blood in her stools, her mother says yes. However, she is not irritable. Her eyes look sunken. On being offered fluids to drink, she does not drink eagerly, which would invoke a suspicion towards a possible dehydration. In order to confirm, the village health worker is asked to perform a simple skin pinch test for which she is already trained. And it takes more than 3 seconds for the skin to return back to the normal position. The next thing that the device does is it assesses the child for fever. Say in this case, the child does not have fever. The next set of questions are directed towards the assessment of malnutrition. The village health worker can make out a visible wasting in this child. There is an edema evident in the feet. On inspection of the palms, they look pale. The device processes the data into a vital diagnosis of a possible malnutrition. Let us see how the diagnosis and treatment are displayed. There is severe dehydration, severe malnutrition, dysentery and some anemia. The pink color is meant to alarm for an immediate referral. The child should be referred immediately for treatment of severe dehydration and malnutrition in this case. She is given the first dose of appropriate antibiotic, which is cotrimoxazole for the dysentery, and iron folic acid tablets for anemia. The child is urgently referred to the PHC, which is a primary healthcare center, for further management. And this can be printed out using a slip like this. So that was Amrita for you. It runs on a handheld wherein you have an advantage of a print like this. At the same time, it can run well on a mobile phone. Thanks you for your patience.